Hi everyone. Today let us talk about anatomy of the middle ear. I know this is a complicated topic and it is a complicated topic. And it's also an important question. It has been asked twice before. So let us try to understand in detail about the anatomy of middle ear. This has come as a short notes. I will try to explain it in detail. You will have to break it down into smaller parts so that you can do it. Okay, you can write the exam. Now coming to the middle ear cleft, what we call the middle ear cleft is not only the middle ear. So this is the middle ear proper. This is the middle ear proper. But the middle ear cleft includes the eustachian tube. It includes the adductus. Adductus is nothing but a pathway, a kind of a doorway which connects the attic. This is the attic. This is the attic. The part of the tympanic membrane above the middle ear, the superior part of the tympanic membrane, which houses the body of the incus and the head of the malleus. Head of the malleus and the body of the incus is called the attic. Okay. So this attic goes posteriorly through the adductus into the antrum. Antrum is the largest air cell of the mastoid air cell system. So these are all mastoid air cells. And this is the antrum. That is the largest air cell. Okay. So what is the middle ear cleft? Middle ear cleft includes the middle ear, eustachian tube. Attic is a part of the middle ear. Okay. Then it includes the adductus, antrum, and the mastoid air cells. Now this is one. Okay. It is lined by mucous membrane. The entire middle ear cleft is lined by mucous membrane. Even the mastoid air cell, each mastoid air cell is lined by mucous membrane, and it is filled with air. Okay. Now let us have a different orientation of the same thing. Okay. Now this is the external artery canal of the patient. This is the mastoid of the patient. So this is where you have the external artery canal. So behind where the opening of the external artery canal, and behind it is the mastoid. Okay, that is the orientation. Now coming to, this is the external artery canal, and this is behind it is the mastoid. Okay, so you are looking laterally. So when you look at it, you will have a tympanic membrane here. When you look through the external artery canal, you have a tympanic membrane. The part of the bony wall which is present above the tympanic membrane is called the scutum. That will come posteriorly. This area is also called the attic. The superior part of the middle ear is also called the attic. This attic will communicate through the adductus. Adductus is a pathway, or it is a communication. Where the adductus will go into the antrum. Antrum is the largest mastoid air cells, and from there you will have multiple air cells in a form of a honeycomb fashion. Okay, so all these are mastoid air cells. So this is an important anatomy. When we are doing a mastoidectomy, we have to have this in mind. Okay. Now coming to the divisions of the middle ear. How is the middle ear divided into? Middle ear is divided into mesotympanum, epitympanum, and hypotympanum. How are you trying to divide it? Suppose, we will come to that, but now this is the tympanic membrane. You are looking in through the external artery canal into the tympanic membrane. Whatever the part of the middle ear that is there, which is present behind this tympanic membrane, is the mesotympanum. So we are talking about this part that is present, right? This part, this is the mesotympanum. Okay, this part is a mesotympanum. The part of the middle ear that is present behind the tympanic membrane is the mesotympanum. The part of the middle ear that is present above the tympanic membrane is called the epitympanum, and the part of the middle ear that is present below the tympanic membrane is called the hypotympanum. So you have the epitympanum, that is the part of the middle ear which is present above the level of the tympanic membrane. Below the level of the tympanic membrane, the part of the middle ear that you have is the hypotympanum. So to mark it, this part is the hypotympanum and this part is the epitympanum. Okay. So what is the significance of this? The significance of this is the epitympanum. We have to understand that the middle ear cavity is not limited just behind the tympanic membrane. It is also present superiorly, and it is extending superiorly and inferiorly. Superiorly, in the epitympanum, you have, as I said, the handle of the the head of the malleus and the body of the incus. And the hypotympanum, you may have a jugular bulb here. Okay, so this is how you can divide the middle ear into epitympanum, mesotympanum, and hypotympanum. Okay, so to put it in perspective, this is the promontory medial bulge. We will come to that. This is the tympanic membrane. This is the handle of the malleus, which is fixed in the fibrous layer of the tympanic membrane. This is the processus cochleariformis. This is the tensor tympani tendon, which is attached to the neck of the malleus, pulling it behind, so that this part of the mesotympanum is the smallest part. The mesotympanum, which is just behind the umbo, is the having the least dimensions. The epitympanum is having the highest dimensions of 6 millimeters, and the hypotympanum is having 4 millimeters. Okay. Shrapnel's membrane is nothing but a pars flaccida. Okay, epitympanum. So this part is a pars flaccida. This part is called the lateral attic wall. It is also called the scutum. Scutum is called the lateral attic wall. Lateral attic wall is also called the scutum. So if I can draw it again, this is the scutum, and this is the attic. This is the attic, and this is the scutum. And from there starts the pars flaccida. From there starts the tympanic membrane. So if you look at it, if it is a tympanic membrane, this is the pars tensa, this is the pars flaccida. Above it, the bony wall that is there is called the scutum. So there is a lot. I used to get confused with the scutum a lot. So now I understand what is the scutum. Scutum is nothing, this part of that bone. You are coming from the external artery canal, and after going down, the tympanic membrane is starting. Just above the tympanic membrane, that is the pars tensa, you have the pars flaccida. Above that, the bony wall that is there called the scutum. In intact canal wall surgeries or atticotomy, you want to you want to open the attic and see if there is any disease in the attic. You can just remove only this part of the that part of the bone. Okay, you just remove this part of the bone. The tympanic membrane, pars flaccida, pars tensa will be intact. You remove a part of the pars flaccida and you open this, you drill out this part of the bone so that you can directly enter into the attic and see if there is any disease in the attic. Or if the disease is minimal, we can do this atticotomy. It is called atticotomy, and remove the disease from the attic. Okay. Now coming to middle ear proper. Middle ear proper is likened to a six-sided box, just like your matchbox. Okay, matchbox. It is more like a matchbox than this one actually. The anterior-posterior dimension is not this much. The anterior-posterior dimension is smaller, just like a matchbox. Okay, just like a matchbox. Anterior posterior dimension is very less. So what does this have? This has a roof. The part above is having a roof. It is having a floor. It is having a medial wall. It is having a lateral wall, and this part is anterior wall. This part, this part, and this part is a posterior wall. So it is having 6 sides: roof, floor, medial wall, lateral wall, anterior wall, and posterior wall. Now coming to the roof of the middle ear. The roof of the middle ear is formed by a thin plate of bone called a tegment tympani. Now as we go, this is the external artery canal pinna. From there we are going inwards. The lateral 1/3 is cartilaginous. Behind that, the bone that is there that you have is the roof of the meatus, external auditory canal, external artery meatus. Okay, above the attic, let me put a different color. Above the attic, the bone that is there here is called the tegment tympani. The bone that is present above the attic is the tegment tympani. It is a thin plate of bone. That bone continues posteriorly to form the roof of the additus, where it's called tegmen antri. Tegmen additus and antrum, where it forms the roof called the tegmen antri. This is separating the middle ear from the middle cranial fossa. The above part is nothing but the middle cranial fossa, where you will have the brain. Okay, it separates the tympanic cavity from the middle cranial fossa. Okay, now what is the importance of this roof of the middle ear? Suppose we are doing the same thing. Now we'll draw a diagram. This is the external auditory canal. This is the mastoid. This is the additus, and this is the attic. Okay, and this is the antrum. Now you are starting drilling in this area. you start drilling in this area to explore, to come to the antrum. Once you have come to the antrum, you will you will be able to see, you will be able to demarcate the mastoid air cell system. They are like thin bones, but as you come close to the attic, the bone is thin definitely, but you can see that it's a plain straight bone. Okay, so that is where you, and also the color of this tegment starts changes, and also the sound when you start drilling and it starts touching the tegment also starts changes. That's how you can find that this is a tegment. You should not breach this tegment because behind it is nothing but the dura. Okay, behind the dura of the middle cranial fossa, and if you are not careful and if you are not oriented according to the anatomy, you may drill directly through the dura and enter into the brain, causing CSF rhinorrhea and causing damage to the patient. Okay, so that is one thing. Another thing is the same thing. I'll just put a diagram again. Suppose this is the external artery canal, but here we have a, what is called a low-lying dura. Low-lying dura. So the dura, instead of here, this much of space is not there. The dura is almost at the level of the external artery canal. The tegment tympani is at the level of the external artery canal. So when you start drilling into it, you think most of the times the space is there 3 to 4 millimeters. But inadvertently you will enter into the, you will breach the tegment and enter into the dura. So this is where you have to be careful when you are opening the antrum, doing a cortical mastectomy. Okay, now coming to the floor of the middle ear. Floor of the middle ear is also a thin plate of bone. It is separating the tympanic cavity from the jugular bulb. So here we have, this is the external artery canal, this is the tympanic membrane, this is the middle ear. Okay, this is the medial wall of middle ear that we'll talk about. This is the floor of the middle ear. Just under the floor is the jugular bulb. Okay, jugular bulb is there. So the floor of the middle ear is having an association or a relation to the jugular bulb. Okay, the roof of the middle ear is having an association with the dura of the middle cranial fossa. Okay, so both are thin plates of bone. You have to respect their integrity. You are doing a surgery. Sometimes this bone may be congenitally thin or dehiscent. So when sometimes it may be congenitally thin or dehiscent. So this bone will come up with the jugular bulb will come upward, and it will be like a bluish tinge you can see through the tympanic membrane. Then you should have or when you open when you're doing a laryngoplasty and you lift the tympanomeatal flap, you see a bluish tinge. Be careful that there may be a high placed jugular bulb, or the bone over the jugular bulb is absent. So be careful, do not damage this structure because it's an important structure and you will have uncontrollable bleeding. Glomus jugulare arises from this hypotympanum, from this jugular bulb area. Okay. Now coming to the anterior wall of the middle ear. Anterior wall of the middle ear. Suppose this is the middle ear, right? And this is the promontory, medial wall of the middle ear. This is the anterior wall of the middle ear. Anterior wall of the middle ear, there are three structures. One is the it is related to the internal carotid artery. The lower half of the anterior wall is having a relation to the internal carotid artery. The upper part of the anterior wall of the middle ear is related to the opening of the eustachian tube. So eustachian tube will go further and open into the nasopharynx. Okay, so you will have an opening of the eustachian tube in the superior part of the anterior wall. Still superiorly, you will have a canal for the origin of tensor tympani. So the tensor tympani muscle, there is this canal for tensor tympani. The tensor tympani muscle originates from this canal and starts going forwards, and the anterior-superior part of the middle ear, it turns medially to get attached to the neck of the malleus. The place where it turns medially, that hook is called the processus cochleariformis. We are going to talk about that in the medial wall of middle ear. So what did we say about the middle ear? It is a thin plate of bone. Yeah, it is separating the middle ear from the internal carotid artery, but mostly in the lower half. It has two openings. One is the opening of the eustachian tube. The other is the canal for tensor tympani. Now, coming to this is the same part, the same thing. Here we are looking from the lateral aspect. This is the tympanic membrane. We are looking. Now we are looking from the medial side. We are looking from the promontory side. Here, this is the medial surface of the tympanic membrane. This is the medial surface of tympanic membrane. Here you have the, this is the handle, this is the head of the malleus, and this is handle of the malleus, head of the malleus and handle of the malleus. So this diagram I have put it so that you guys can understand that this is the facial nerve, the vertical part of the facial nerve that is there. So here you have the chorda tympani nerve that is arising from this, and while it passes through the bone, and through an opening called the posterior canalicus, also called the iter chordae posteriors. You can just remember posterior canalicus. It enters through this opening called the posterior canalicus and passes in between the neck of the malleus and the body of the incus, and after passing through the middle ear, it exits through this opening called the canal of Hugger. Okay. So, and there is another structure that is present. There is something called a petrotympanic fissure that is present at this part. Petrotympanic fissure, that's the fissure in between the temporomandibular joint and the tympanic cavity. Okay, you don't have to remember, but you have to remember that there are like 1, 2, 3, 4 structures. One is the opening canal for tensor tympani, opening of the canal for tensor tympani. Then you have the eustachian tube. Then you have the canal for Hugger, through which the chorda tympani exits the middle ear. You have the petrotympanic fissure. These are the 4 things that you can see on the anterior wall. On the anterior wall, you see these things. Okay, lower one is eustachian tube, upper one is for canal for tensor tympani. Above that, you'll have the canal for Hugger and the petrotympanic fissure in the anterior superior part. And lower part, it is separating the anterior wall is separated from the internal carotid artery by a thin plate of bone. Okay. Now coming to the lateral wall of the middle ear. Lateral wall is formed largely by the tympanic membrane. Bony outer attic wall is called the scutum. We have talked about this before. Let me just put this in perspective again. So this is the external auditory canal. This is the pars flaccida. This part, only this part is the pars flaccida. This part is the pars tensa. So this is the tympanic membrane. Above the tympanic membrane, you can see this bone that is coming like this from above. Okay, that is nothing but the scutum. This is scutum, also called the outer attic wall. Outer attic wall, because this is the attic. This is the attic, and this is the lateral side. This is the wall that is separating it from the outside laterally. It forms a boundary of the attic. So if you drill it, you can directly enter into the attic, and that becomes atticotomy. Also in CSOM atticoantral disease, as we already talked about, pars flaccida is thinner compared to the pars tensa. Pars flaccida is thinner compared to pars tensa. So this is a chance where this is a place where you have retraction when there is a negative pressure in the middle ear because of eustachian tube obstruction. That negative pressure will affect the pars flaccida first. So if you look at the tympanic membrane, this is the anterior malleolar fold, this is the posterior malleolar fold, and this is the handle of the malleus. Here there will be retraction, and if that retraction continues further, you will form cholesteatoma, and that will do what? It will start eroding the scutum. The scutum gets eroded slowly starts getting eroded, and finally it may enter, the cholesteatoma can start entering into the middle cranial fossa and start causing intracranial complications of CSOM, unsafe type. Okay, that is the importance of the scutum. Scutum is a lateral attic wall. You can enter into the attic by opening the scutum, entering into the attic, we call it atticotomy. Okay, thank you. This was actually the easier part of the middle ear. Now we will, the next part, let us talk about the posterior wall and the medial wall of the middle ear, which are like more complicated and a little bit tough. Thank you so much for the patient listening.